Today our topic of discussion would be nasal septum and its diseases. It is a very important topic. Before going into further discussion, we should be knowing about the anatomy of septum. The nasal septum is having three parts: the glomerular septum, the membranous septum, and the septum proper. The glomerular septum is the medial crura of the alar cartilage. The membranous septum is having no bone, no cartilage, only a double layer of skin. The septum proper is quadrilateral and is having three parts: the perpendicular plate of ethmoid, the vomer, and the septal cartilage, which is quadrilateral. So this is osteocartilaginous structure. If you can see this diagram, this is clarifying everything. This is actually the septum and the three parts. This is the glomerular septum, this pinkish is the membranous septum, and this is the septum proper, having three parts: septal cartilage, vomer, and the perpendicular plate of ethmoid bone. This is the Little's area, which has been discussed more properly in epistaxis. This is actually present in the antero-inferior part of the nasal cavity, and it is the most commonest site of epistaxis, and it is a site of union of four different arteries, which are mentioned here, right? Our topic is now the fractures of nasal septum. There are majorly, you know that fracture can happen anywhere, either by falling, either by sport injury, or some different other causes, many different causes, right? So there are two types of fracture depending on the direction of impact. The Jarjaway fracture, in which the impact is from the front and it is running horizontally or diagonally, right? And then is the Chevalet fracture. I hope that I'm pronouncing it right. Chevalet fracture of the septal cartilage, in which the blow is from below and it runs vertically. If you can see this diagram, if I give a blow from here, this will be the Jarjaway fracture, and it is running horizontally backwards or diagonally backwards. And if I give a blow from here, this will be the Chevalet's fracture, in which the break or the fracture is running in a vertical direction, right? Moving on, what happens is that whenever there will be a fracture, there will be bleeding and hematoma can be formed. So our treatment is you have to drain the hematoma, and if it is dislocated, you have to locate it properly, and repositioning should be done. Complications are that if it is overlooked or if it is not treated properly, its injuries are ignored, it can lead to deviated nasal septum and asymmetry and hematoma and further complications. One important concept for viva is that if there is mucosal tear, there will be epistaxis. But if the mucosa is intact, then the blood will accumulate beneath the mucosa, leading to the formation of septal hematoma. Moving on to our most important topic, which is deviated nasal septum. It is having different etiologies. Either it may be traumatic, developmental error, racial factors, and hereditary factor. It is having different types, which are important. It might be anterior, right? Or C-shaped deformity, S-shaped deformity, or spurs or thickening. In anterior dislocation, the deviation is towards one side. In C-shaped deflection, one side is convex and one side is concave. The convex side is atrophied. On the other hand, the concave side is roomier and it is having hypertrophy of the turbinates. And in S-shaped deflection, there is bilateral nasal obstruction. There is obstruction here, there is obstruction here. Only in this particular aspect, there is unilateral obstruction in C-shaped, but in S-shaped, there is bilateral nasal obstruction. In nasal spur, this is actually a shelf of bone that has been formed. This is an abnormal projection that you can see, right? This is a shelf-like projection often found at the juncture of bone and cartilage. This is actually spur. This will also lead to the nasal obstruction as well as deviated nasal septum. And sometimes there is thickening of the nasal septum in any sort of hematoma or injury whatsoever, right? Clinical features are very important. For example, if you're having a deviated nasal septum, what will you be experiencing? You will be experiencing nasal obstruction, right? Headache, sinusitis, epistaxis, anosmia, external deformity, middle ear infection. This is very difficult to remember, so you should be remembering this with the mnemonic of NASE HME. NASE HME. N for nasal obstruction, A for anosmia, S for sinusitis, E for epistaxis, H for headache, M for middle ear infection, and E for external deformity. One test that you can see is Cottle test. This is used to differentiate that either the obstruction is vestibular or it is beyond the vestibular area. So you just stretch your cheek like this, as this girl is doing, and if you feel any betterment in the inhalation, it means that this test is positive and the nasal obstruction is at the level of the vestibular compartment of the nasal valve, right? The treatment is that you just have to do septoplasty, the most preferred treatment. Submucous resection was used and it is it is now also used. It doesn't mean that it has now been obsolete, but now the preferable is septoplasty. The difference is that submucous resection is done only in adults. And in this particular aspect, there is more invasion, and the elevation of the mucoperiosteal flaps is on both sides, whereas in septoplasty it is only on one side. And the benefit is that it can be done after 4 years. So children are preferred with septoplasty, right? So this is it. And our next topic is septal hematoma, right? For example, a trauma is occurring, right? Hematoma occurs. This was the septum. Now blood has also accumulated. If it is drained, very good. But if it is not drained, what will happen? Secondary infection will occur. Then what will happen? Necrosis will occur. Then what will happen? Septal perforation will occur. Then what will happen? The dorsum of the nose will be depressed, right? So these are the complications that can occur with septal hematoma. So what is a hematoma? It is a collection of blood under the perichondrium or periosteum of the nasal septum. So what is the clinical presentation? The person comes that I was playing and I had a trauma, whatsoever cause of trauma, then I experienced bilateral nasal obstruction, frontal headache, and now I'm feeling a sense of pressure over the nasal bridge. So what will you be looking for? This history, then you will examine, you will see the bilateral nasal obstruction, right? And then you have to drain. If it is a small hematoma, a wide needle bore is more than enough for aspiration. But if it is a larger hematoma, you have to incise it and drain it, right? And after drainage, you have to pack the nose. Nasal packing is done. And if it is for many days, then you should also be giving systemic antibiotics to prevent septal abscess, a complication of nasal packing, right? For example, what happens is that as I've discussed earlier, if we have not treated this septal hematoma, what will happen? It can either thicken, right, leading to nasal obstruction, permanently thickened septum. It can organize into a fibrous tissue. Secondary infection can occur, after which abscess will form, necrosis will occur, and depression and perforation will occur, and then the depression of the nasal dorsum can occur, right? So this was septal hematoma. Moving on to septal abscess, you all know that it results from secondary infection of septal hematoma. So now the clinical presentation is differentiating feature. There will be bilateral obstruction. Okay, here was also bilateral nasal obstruction. What is the difference? Here the patient will say that I had a trauma, now I am not able to breathe, but now also I am experiencing fever with chills, right? Fever with chills will give you the sign of secondary infection and septal abscess, right? Submandibular lymph nodes are also enlarged. The treatment is the drainage of the abscess, and if it is large, you also give incision, right? And the incision can be opened after 2 to 3 days. For example, pus is again accumulated, so you have to open it via incision and also give a course of systemic antibiotics. The complications are, as you all know, if abscess is not treated, what will happen? Necrosis will occur. Then what will happen? Depression will occur, right? Or perforation of the septum will occur. So these are the complications, after which if you have to treat that depression, then you have to do augmentation rhinoplasty. That's a different debate. Moving on to our next topic, which is the perforation of nasal septum, right? It has different factors that lead to the perforation. Sometimes, and most of the time, it is traumatic, right? It can be pathological. For example, if there is an untreated septal abscess, as you have discussed in the complication, that perforation can occur. Nasal myiasis. This is actually the presence of maggots, presence of foreign bodies, insects in the nose. They can also cause the perforation. Rhinolith, presence of any sort of debris, chronic granulomatous conditions, and Wegener's granuloma. So you should be remembering it can be traumatic in nature, pathological in nature, pathological cause. Drug and chemicals can also cause. Those who are cocaine addicts continuously snuff the cocaine, this can also lead to septal perforation, and sometimes it is idiopathic, right? So now what will the patient say? Patient will say that when I inhale, I have a whistling sound, right? Whistling sound during inspiration or expiration. This is an indication of small anterior perforation. Small perforation will give this characteristic finding. And the larger perforation, in which their whistling is not that much prominent, now the crusts will form, which will obstruct the nose. And when the person will remove those nasal crust, what will happen? Epistaxis will occur. So what is the treatment? If the septal perforation is small, you can surgically close it. Good. But if it is large, then it is very much difficult to close, right? So we say the patient to keep your nose clean, keep it crust free, And sometimes for temporary relief, or we would say for temporary treatment, this is a button which is known as the celastic button, can be worn, and it can close that perforated area, and it can help you benefit the inhalation. So this brings us to the end of nasal septum and its diseases. Every disease, deviated nasal septum, septal hematoma, septal abscess, and the perforation of nasal septum are of prime importance. Hope you understand.